Look, welcome, Cody, and look, thank you for being the first person who's going to be part of a monthly series we're going to do around Dale Talks. And it's an opportunity for me to have a discussion and meet staff and talk about what brings you into this organisation. So if you could just tell me a little bit about yourself and how you've landed here at the Hutt.
I'm sure. I was born and bred in Hutt Valley, including the hospital itself. My mum's worked here since I was about 5 years old. My cousin, she's been here for about 15 years, and I worked here for about 13. So I came from Title College and started working part-time when I was 15.
Just in terms of your current role, what does that actually involve?
So that we're working on. So we're collating a lot of data around leave balances, and we're reaching out to staff now. We're trying to do it so that it's focused on the well-being of our staff as opposed to the financial side of things. There is a need for both to be looked at, but more importantly, we need to think about staff well-being.
So just in terms of the role, what have you found to be the biggest challenges?
I guess the biggest challenges here are some of the systematic issues that we have. So that's been a bit difficult. That's probably one of the main struggles, really.
So look, just tell me about some of the work that you've been doing with other district health boards and how helpful that has been.
So when I first started the project, I actually reached out to two DHBs, one being the best in class and one being, I think, the second worst in class. However, they had started the same work that we're doing. So as opposed to reinventing the wheel, we're working alongside each other and supporting each other and sharing information, and that includes some tools that we've created already, and that's been a really good resource to have.
So that's sort of perhaps the worst of it. What's been the very best of it, and what have you really found rewarding?
Being able to actually still take a personal approach to it as opposed to you must take some leave approach, and that's where I came up with I guess the naughty name of Project Kit Kat. But if you know Kit Kat, they had the slogan, have a break, have a Kit Kat. And so that's why I went with that. It was a more fun, friendly approach as opposed to you're taking some leave.
That's excellent. So I understand that you've got a major event coming up in your life in the next month or so, which is all very exciting. Just want to tell us about that.
Yes, well, I'm getting married in February. Which is really exciting, actually. It's a good time of year and good time to be with family and friends. So I'm really looking forward to that.
I understand your fiancée is also a person who works and has contributed significantly to the house as well.
That's great. She's worked here as well for quite a decent amount of time, and she still loves it here as well.
Well, that's really exciting. I wish you all the very, very best for your day and for your life. Look, just tell me a wee bit about yourself in terms of what gets you up every day to bring you to work here.
I think it's the fact that I still love working here. As I said, I've been here for 13 years, and one of the key things I've noticed about this hospital is it's a family-friendly environment, and that includes, I was thinking back, when we had our different CEs. I was here when Chai was here, and he always made an effort to go out and meet staff, and then we had some in between, and some weren't as good as others. But then actually came back, and he started to become, take time to come out and meet staff, and then you're doing the same as well. So it's good to see that senior management is still coming out to see everyone here at the hospital, and I think that's a great way to keep, to recognise who you're working with.
Well, thank you very much, Cody. I've really enjoyed catching up and really enjoyed the project that we're getting on. And I also would like to really emphasise the humanist approach that we're taking, particularly as we go around this project around leave management. It's taken many years to get to where we are, and it's going to take a long time. And we've always got to remember the people at the front and centre of what we're doing. And I really enjoyed your approach and how kind and approachful you have been. So thank you very much, and thank you for being the first of talking to me.